So as the program committee began thinking about the funding panel, you know our number of funders who have been coming to SNRS has increased, and that has been wonderful. We have 2 governmental agencies here with us this year, as well as other foundations, SNRS of course, and other groups who provide sources of money to support our research. But being an avid reader in professional journals, which I get the PubMed 24-hour search for me, I started to read a lot of Vicki Conn's papers. And in fact, there was one paper she wrote on faculty workload, and I sent that to my dean, and I sent that also to the SNRS board and the program committee, and you really got me thinking. So then some people started telling me about some of her previous talks, and I said to the program committee, we've got to get Vicki Conn here. So she graciously agreed to come. I turned on my little southern charm and told her that it was warmer here, it was wonderful, that we had fun at SNRS, and that she needed to transfer her membership to us. We do that often, Vicki. She is a member of SNRS, so let me do her introduction very quickly. She's the Potter Britton Professor and Associate Dean for Research at the University of Missouri School of Nursing. She's also the editor of Western Journal of Nursing Research. She conducts meta-analysis research on exercise behavior and medication adherence. Her current NIH RL1 is a meta-analysis that is looking at characteristics of interventions to successfully increase physical activity. So maybe we could look at the SNRS program this year and see if that has increased physical activity among our participants. Welcome, Dr. Conn.
Thank you for the kind introduction. I know we always wonder where speakers come from at conferences. How did they end up with these people? And I can tell you where this stream of talking started. In my role as editor of Western Journal of Nursing Research, I have to write editorials. And I mean, I should say I have the opportunity to write editorials. And sometimes one has to think about what to talk about. So a couple of years ago, after the economy went south, went poorly, I should say, instead of south. I apologize. I didn't mean to offend anyone. The economy it declined, and funding opportunities were a problem, as well as School of Nursing funding. I wrote an editorial called "Keeping Nursing Research Afloat in a Sinking Economy." And subsequently, the doctoral conference invited me to speak on the basis of my editorial. And I said, sure. I thought, well, I already have an editorial. Well, an editorial lasts about 5 minutes. But I was delighted to have that opportunity to speak with them about strategies to keep research moving despite challenging fiscal times. And I suspect that that talk and presentation was part of the impetus to invite me here. So I'm delighted to have this opportunity to talk with you about stellar scholarship on shoestring funding. First, I bring greetings from the beautiful University of Missouri School of Nursing. I wish the weather looked like that now. We have a lot of snow, so coming south was definitely an advantage for me. The purpose of my presentation is to stimulate discussion here at SNRS, in your colleges, and among nurses in general about building knowledge with limited fiscal resources. Other speakers are going to talk about funding options. Of course, these funding options are incredibly important to build nursing science. But I want to encourage us to start a conversation about how to build science with limited fiscal resources. In these difficult economic times, our academic institutions are facing Major funding problems. Many states have slashed budgets for universities. Endowment income is down in both public and private universities alike. Administrators have cut campus-wide services as well as budgets to colleges and schools. Funding agencies also are facing limitations. The fiscal environment has affected them as well. They're able to fund fewer projects and sometimes projects with smaller budgets. These cuts are forcing nursing schools to carefully evaluate how they allocate resources. Both leadership and faculty find it difficult to negotiate priorities among research, education, and service, and in some schools with a significant practice component. The current fiscal crisis may exacerbate pre-existing uneasy tension between education and research missions. As budgets grow tighter, the pressing need to cover teaching assignments may seem more important than the long-term investment in building knowledge. We all know the challenge of countering the tyranny of the urgent with allocating resources to long-term importance. But what about the future? Won't things get better? Isn't the economy turning around? Moody is an investment advisement service which attempts to provide objective external assessment of potential investment opportunities. They're not focused on higher education, but they did put out a report. They put out 2 reports in January of this year, one about higher education and the other about academic health sciences centers. They assert that it's not realistic for universities to simply wait for the current fiscal crisis to resolve, because both universities and academic health centers face revenue challenges from several sources beyond the current fiscal crisis. For several reasons, Moody suggests higher education will need to dramatically change to remain fiscally solvent. And Moody says the worst may be yet to come for universities and academic health sciences centers. They indicate that the fiscal crisis in these locations will increase instead of decreasing in the immediate future. So we must find ways to build knowledge despite fiscal challenges. One strategy is to build research looking beyond the traditional funding mechanisms. For example, many of us have been very focused on federal funding, specifically R01 funding. That's been our goal. How can we get R01 funded projects so we can do large projects that contribute to knowledge development and that change practice? We may need to think about other options for funding our areas of science. State governments often have some money for specific areas to improve the health and well-being of their citizenry. These can be a nice option for funding our projects. Unfortunately, some of us have kind of looked down our nose on these funding sources and said, well, that's not real research. That's not the kind of money I want. It doesn't have as much facility and administrative costs. My university doesn't like it. But these funding sources can be wonderful options to begin programs of research or to build expertise in a particular area. One of our faculty members identified, she had been a nursing home administrator prior to receiving her doctoral degree. When she moved to Missouri, she identified that Missouri had a bed tax on nursing homes. So nursing homes paid a fee to the state based on every bed that they could potentially occupy, and that this money was designated to improve quality of care in nursing homes. Well, it was just sitting in the pot. The state was not doing anything about improving nursing home quality. So she began with a small contract with them. It's now been 20 years that she's had contracts through the state to improve the quality of care using this bed tax money. What she did with this was she found a model of improving quality of care with verifiable outcomes, and she has used that same model in NIH-funded research. Most recently, she received a CMS grant for $14.8 million using the same model to improve a different aspect of nursing home quality of care. And I might add that's the largest research grant that our university has ever received, and it came to the School of Nursing. We are happy girls. We are happy girls. But that's an example of starting by looking at a non-traditional source and looking at funding for projects that we might not traditionally call research, but they generate knowledge, they generate skills and expertise to build nursing knowledge as well as for future studies. Some nurses have been very successful in securing funding from private foundations and companies, and more nurses need to begin to develop those skills. While information from major foundations has been circulating for years, an emphasis on local businesses has been less common. Businesses often prefer to fund projects that are local as part of their community citizenship as a local business. Research projects, which could be reframed as public service to the community, may be especially attractive. Proposals to these funders are often very different from the research proposals many of us have been prepared to write. Fortunately, most colleges have some sort of access to development officers who can help us design pitches to businesses and foundations that they might find attractive. A working relationship via joint projects can be effective. Joint projects include the company and the researcher designing and implementing studies. For example, most businesses would like to improve the health of their employees. They would also like to reduce absenteeism and decrease health care costs. Many nurses study the common chronic illnesses which are costly and affect productivity, such as diabetes, heart disease, arthritis, and depression. Projects to improve chronic illness self-management could generate important new knowledge as well as improve the bottom line in businesses. Another approach to private companies is to propose a project with special interest among the leadership at that company. For example, a CEO recently diagnosed with breast cancer might be especially interested in funding projects related to cancer treatment symptom management or cancer survivorship issues. A director who has a grandchild recently diagnosed with autism might be especially likely to fund projects related to autism. And information about these kinds of health challenges are often available in the local community. Sometimes people keep this information very private, but often it's not private. Often it is widely known that company officials are facing these kinds of challenges. Another strategy is to link directly with populations who want knowledge built in a particular area. For example, self-help groups could become partners in research projects. And I'm talking about more than the self-help group just helping you recruit subjects. I'm talking about more like an extreme form of participatory action research where you work with the self-help group to identify what they consider to be problems, design studies, and implement the studies with them. This brings up an important issue. A few people who have become researchers, I know this doesn't apply to you all, but a few of us have control issues. That's one of the reasons we like research. You control things in research. When you're going to do research jointly with businesses, with self-help groups, with other sorts of partners, you have to give up a little bit of that control. And that's something that some of us may need to learn to do as we seek new ways to fund projects. I know that doesn't apply to you all. Linking with other researchers who have resources can be effective. But we need to think beyond other healthcare professionals. We tend to think about physical therapy, occupational therapy, medicine, medical social work as people that we might collaborate. We need to move beyond that. For example, colleges of education have a lot of interest in the health of both teachers and students. They also have good linkages with school systems and with organizations that could actually implement projects. So if you're working in the area of pediatrics, they could be a good colleague. Even if you're working in the area of adult health promotion, they might be good colleagues to work on health promotion projects among teachers. Another example, far too few nurses are working with engineers. Engineers are fun. They have great skills to develop products. They're very creative, very innovative. The problem is they don't know what problems could be addressed with their skills. They don't really understand the problems of patient populations. One of our faculty members made an initial presentation to the engineering college. First, she had to get through the dean to convince him that it was worthwhile for her to come to a faculty meeting and talk about old people. She then began linking with the College of Engineering. They were ecstatic about this. And as you might guess, engineering schools have more money than nursing schools have. They internally funded a center on assistive technologies for older adults. They continue to fund that in the College of Engineering because they're so excited about these projects. They have had many joint projects. The engineers' PI projects to funding agencies that the nursing faculty members would likely not be successful at, and they get funding from those sources to fund these projects. The engineers are totally fascinated by what the nurses know, which is a lot of fun for the nurses that work with the engineers. Engineering graduate students do their research projects, their dissertation projects on developing these products for older adults. We really need to think more about engineers and other folks who could have skills to develop things that would help our patients, but they don't know what the patient's problems are. Another set of strategies to do research with limited funding is to make our research more effective and efficient. One strategy to make science more efficient and effective is to focus on projects which will best move knowledge forward. That means high-impact research. While significance is about the magnitude of the problem, scientific impact is about how much a particular study could affect future research, practice, or policy. Slaying substantive gnats with methodological canons does not constitute forward movement of science. An unimportant problem addressed with highly sophisticated design and analyses remains an unimportant problem. We need projects that are not only technically sophisticated, but move knowledge forward. We continue to swat at gnats. We make elaborate arguments about how interesting these gnats are. But interesting does not equal important. As a discipline, we can no longer afford these interesting but unimportant projects. We tend to think of the research resources as belonging to the individual. What are my skills? How much time do I have to do my projects? Or sometimes we think of research capacity as being within a college of nursing. How many faculty do we have that have research skills? How much time do we allocate for them to work on their research projects? And that's our research resource. But we need to think more about, as a discipline, what is our research resource? And are we really using it to build knowledge? If my colleague several states away is doing interesting work on gnats, that's really not building our entire discipline's area of science. And we need to think about our resource as a discipline-wide resource, and how can we encourage one another to do studies that build nursing knowledge. Good metrics to assess the impact of research are needed. It's especially difficult to assess the impact on practice. There are some strategies to address the impact on future science or in current science, and these largely are related to citations to particular papers or particular sets of papers. If you haven't done an H-index, it's very interesting, and you can just Google the phrase H-index. I put the directions here, but if you just Google H-index, you will find the directions. H-index scores for a particular individual how many of their papers have been cited a certain number of times, and that's your H-index. For example, if your H-index is 20, 20 of your papers have been cited at least 20 times. It's very interesting, very interesting. Don't do it on yourself if you're a junior faculty, because there's not yet time for your work to be cited. But if you're a senior faculty, this is very interesting. Well, honestly, it's also interesting to do it on a few of your friends to find out what their H-index is. But my official suggestion is to pick 5 to 10 people that work in your area of science, again, not junior faculty, it needs to be senior faculty, and run their H-index to see who's having the biggest impact. When you run the H-index, you also see which papers are being cited, and that's a way to look at, out of that person's whole body of work, which papers are the most cited, and therefore which ones are likely having the largest scientific impact. Sometimes that's surprising. Over 20 years ago, I did a small project with a group of advanced practice nurses about patient education for people with heart failure. We created an instrument. I remain embarrassed to this day that we did absolutely no testing on this instrument. No validity, no reliability, nothing. It was just the 5 of us sitting down and saying, oh, well, I think this should be on the instrument. Bad work. But it was a project that I was actually hired by the hospital to help some of their advanced practice nurses do some research. I still get requests for that instrument. I put in the email when I send it back, yes, you may use it. Please be aware we did no validity and reliability testing on this instrument. And it's one of my most cited papers. One of the advanced practice nurses first authored the paper, but she said, you know, I don't really want to deal with anybody if they actually ask me about the paper. Can we put you down as corresponding author? It's one of my most cited papers, and it says a lot about what kinds of things have impact. It's not only how well the study was designed, but it's how important the topic was. Because at that point, people with heart failure were just starting to live. Before that, if you had heart failure, your life expectancy was incredibly short. But that's an important group. People were wondering, how do we educate these patients to better take care of themselves? And so that project was widely cited, and I still get requests for the instrument. But look at somebody who's working in your area of research and see which of their papers are the most cited. That will tell you something about what kind of work has the most impact. It's not always the work that we personally think is the most interesting of our own work. It may be work that we would consider a little bit off the radar, but somehow it is having an impact. And as a discipline, we need studies that focus on solving problems and therefore having high impact. This is our traditional model of building knowledge. We do a small study in our dissertation, and then we use the findings of that to build study A, a little bit bigger study. We do that in our postdoc or in our junior faculty position. Then that builds to our next study, study B, which is even a little bit larger, maybe with small external funding, and then we're ready for study C. Study C is the R01. We're moving toward it. Everything is moving directly toward study C. We get the R01 funding, and we solve a practice problem. Well, it's a problem then for the investigator if they don't get the funding for study C. What do they do next? All their eggs are in one particular direction. We may need to rethink that model of building knowledge to have more flexibility and allow more options. Do some people recognize this as their trajectory? I'm the ultimate goal-directed person, trust me. I really like that one study after the other study. But there may be reasons to think about alternative models where we do clusters of related studies on topics that may ultimately actually generate more knowledge than just the design for one big study. Models that allow for various projects with various levels of funding to complete those projects and still build knowledge may be an important part of our future. That straight line may not be as feasible for some of us. The point is, do all of the arrows ultimately lead to knowledge for practice? As a discipline, we need knowledge for practice, and are we building the studies that move in that direction? Supplementing existing studies can increase knowledge. We can add value to projects by adding additional outcome or mediating variables. Many quantitative studies would benefit from adding qualitative questions. For example, intervention research often has some studies, have some subjects who benefit from the intervention and others who do not. Qualitative interviews with those people can identify the context, the meaning, the experience that may account for those differences. Data from existing projects address questions about usually the individual unit of analysis, but it's also possible to actually use the results from previous studies. The proliferation of primary research in many areas of science makes it a fertile field for all sorts of research reviews, qualitative synthesis across studies, as well as quantitative synthesis using meta-analysis. Okay, you knew I was going to mention meta-analysis. What can I say? Another way to make our research more efficient and effective using limited resources is to really build on existing research. Okay, you're saying, I already do that. I've read the literature. I know what's already been done. Of course, I'm building on past research. But what happens is many of us rely on amateur searches of the literature. I think everyone in this room is probably an amateur searcher. How many of you had formal coursework in how to search databases? A few did. A few did. And do you know which year certain terms changed between an old term and a new term? Most of us don't, unless you have done some library sciences research. We really need to use the experts when we search. The experts are reference librarians. How many people know the first name of their reference librarian? Good job, good job.
Phone number, cell number, email.
I don't think you probably need to have their personal cell number. I think that might be extreme. But you do need to work with them. They are the experts. They spend all of their life learning how to do this and implementing these searches. And if you really want to know what's been done, we really need to have better searches. And of course, we need to be prepared to do both qualitative and quantitative synthesis. Few topics in nursing science require one specific kind of research methods. Increasing faculty expertise in diverse research methods may open new awareness of fiscally conservative research possibilities, as well as identify new collaborators. There are many opportunities to learn new research skills. There are lots of summer institutes. In your southern region, Margie Sandalowski does an institute in the summer on analyzing qualitative data. I've heard fabulous things about that institute. There are lots of distance-mediated academic courses that are now available to learn specific skills. We are running a meta-analysis institute. Lots of opportunities for faculty to learn new skills. Another possible way to stretch limited resources is to use expanded team approaches. Multidisciplinary studies can be complicated, but they can better answer complex problems. Movement toward team science, really team science, may mean that colleges of nursing need to address their promotion and tenure guidelines as well as distribution of resources. More faculty team research would better prepare our doctoral students for future team studies. Most researchers say they work in teams, but we need to move past small typical teams at specific schools. My journal editor role allows me to see science in a different way. In one 6-month period, we received 3 separate manuscripts, no overlapping authors, for 3 different measures of the same construct. And when I received the third one, I went back and looked at the previous two, and I found each of the authors, each of the three, cited the authors of the other papers for doing developmental work on the concept or preliminary work on an instrument. One wonders what could have been gained if they all worked together to build a great instrument instead of building three separate instruments. Another strategy to increase efficiency is to specialize research foci in schools of nursing. We know that size matters. Schools with more full-time doctoral faculty have more NIH awards. A correlation I found from a 2008 article was 0.7 for that. Part of that success may be related to clusters of faculty with related interests. Research interest groups can support collaborative projects among senior and junior faculty. They also can really support collaborative projects among senior faculty. Even among faculty who've been in the same school for 20 years and have offices on the same hallway, there's an amazing lack of awareness about each other's research. If we form research interest groups, it's a structured opportunity to become more aware of each other's interest and to continue to build senior researcher skills. It's also an opportunity for students to become involved in a particular topic beyond their own advisor. Proactive leadership can facilitate strong team science by recruiting for specific teams. Clinical faculty in schools of nursing often decide to become doctorally prepared based on their educational role teaching, and sometimes they have a specific school in mind where they plan to have a tenure track role after completing their doctoral degree. That's the point at which leadership can help that new doctoral student or person preparing to become a doctoral student to select an area of research that's consistent with existing strengths in the school. Given the proliferation of distance programs, this new student can likely find a program with expertise in that particular area of science. So when they finish their doctoral degree, they are ready to join a team and to contribute immediately to developing knowledge. The emphasis on team science will make us rethink the whole notion of who's in charge of research projects. We need to reconceptualize leadership when we have true team science. Policies and practices of rewarding research productivity will need to be re-examined to really understand how we can benefit from team science. Too few schools of nursing link with other schools of nursing. Even among active research universities, there are pockets of individual investigators who don't have colleagues to work with. Among smaller schools of nursing, there's many advantages to potentially linking with other schools of nursing. I was fortunate to be part of a regional consortium on gerontological intervention research, which was formed by Iowa. The original schools were Iowa, Missouri, Minnesota, and Wisconsin. Later, the consortium expanded to 12 smaller schools that were not considered research intensive. Look at the productivity that came from those experiences. That's a lot of articles and a lot of grants. It really built relationships among researchers at different universities that continue to be very productive. Another issue is the extent to which we embed research in education. We need to involve students at multiple levels in educational and research projects. True, not all projects can be done jointly with students, but most research topics have some sort of a research question which could be shared with students and student participant researchers. We need to rethink PhD education. When we rethink it, we typically add more skills courses, but we need to rethink how we educate doctoral students to be ready for doing research with limited funding. If all of our preparation is how they're going to be successful at getting R01 funding, then there's a significant proportion of our doctoral students that we're not serving very well because not everyone's going to have R01 funding. So we need to think about how are we preparing them to do stellar research on shoestring funding. There are systems level options that may help increase our efficiency and effectiveness. The commitment of the dean to research is incredibly important. A faculty and leadership governance arrangements which encourages creativity also encourages research activity. Research culture which allows people to try new ventures that may not be successful is important. Handling these so-called failures is very important. Schools might consider separating the person who assists with developing research skills from the evaluative process. If someone's grant is not funded, they really don't want that to be the center of their annual evaluation. So some strategies to build productivity and to deal with those kinds of issues. If faculty only submit grants that are certain to be funded, then they're not trying hard enough. They need to be aiming higher. The same thing with manuscripts. They need to be aiming higher and be able and willing to deal with those diversions that are sometimes called rejection. Another strategy to increase research capacity is to change the allocation of effort among nurses prepared to conduct research. Perhaps we could increase efficiency by specializing faculty in research activities. The obvious face value of teaching, service, committee work can appear to offer bigger and more immediate rewards than research. That semi-sacred multi-role, I call it the triple threat, everybody has to teach, everybody has to do research, everybody has to do service, is clearly not working in many universities to build research knowledge. Another area where specialization could be effective is in the Associate Dean for Research role. Many of those roles combine being Associate Dean for Research with Director of the doctoral program. Is there any evidence that someone who knows a lot about research methods is prepared to administer a complex educational program? Is that our best use of how we can allocate faculty efforts? Perhaps another model should be considered in some institutions. Another strategy for potentially increasing research capacity is to selectively invest in faculty. Differences in research potential may be partly related to preparation, but also sometimes related to individual attributes. And some programs of research are more likely to influence nursing practice because of the nature of the topic, or perhaps because they have a well-developed trajectory of serial studies or clustered studies that will change practice. Faculty with research more connected to other researchers may be more likely to succeed and more likely to benefit researchers besides themselves individually. Selective investment, be it time, pilot study funding, purchasing external mentoring, travel funds, all those sorts of things can be used to selectively invest in faculty. Okay, I hear you saying, but that's not fair. Identical treatment is not the same thing as fair treatment. Remember that, telling your kids that? Yes. Just because I don't say exactly the same things to you does not mean it's not fair. We need to think strategically in our schools of nursing. Where can we best allocate our resources? Who is the best teacher in that particular course? Should it really be rotated around because 4 different people want to teach it, or is somebody really better at that course than the other 3 people are? The same thing may be true for research. Does someone have a better set of skills or options that make it efficient for that university to look at investing more research time in that individual? I stated my purpose was to generate discussion. Let's open the session to your ideas about how we can build stellar research on shoestring funding. I think we have time for that?
We sure do.
Yes.
So time for questions. Is there anyone, does someone want to start? Yes, Karen.
You could probably say more about it than I could, because you're actually doing it. I guess I would agree with you that it's an incredibly valuable resource. It makes sure that the research questions are relevant to practice, because the practice setting is involved in it. I think the faculty member has to understand that desires and interest in the clinical setting may change more rapidly than their research trajectory changes, so that they're building a cluster of studies instead of just one study moving to the next study. It's an ideal way to involve students, especially advanced practice students, in research projects as well. But honestly, you could probably speak to it more than I could. Great topic, though. Maybe that's a topic for a future session here about building those partnerships.
If you have questions, you may want to come forward. I'm not saying that Karen has a big mouth, but we're friends, so we could. Go ahead. Can you?
I just wanted to make a comment as far as the systematic reviews. One of the things that we have in our area is we have a Joanna Briggs Center, and they do some very nice education on performing systematic reviews. And one of the things that we're doing in our systematic review is that we actually have a librarian who is a member of our systematic review team.
Librarians are wonderful, and they have skills that we simply don't have. I agree we need many more review papers. There's lots of research done on our topics, not necessarily by nurses, but there's relevant research on our topics, and we need excellent reviews of those. And most journals are now delighted to publish review papers, so that's a good option for a publication.
Over here.
We need to start yesterday, because it's such a slow process to change things like promotion and tenure guidelines. And it's a different strategy depending on how promotion tenure works in a particular college. In some colleges, the college makes the decision, and they have a lot more flexibility to change their guidelines. In other systems, the college makes a recommendation that then goes to a campus committee. I would guess that many of your campuses are increasingly interested in interdisciplinary research. That seems to be a common theme we're hearing about interdisciplinary research. That could be a wedge to start reconsidering at the campus level promotion and tenure guidelines. The other issue is many promotion and tenure procedures involve external reviewers. The materials go out to external reviewers who make statements about whether or not the person meets the guidelines. Typically, the guidelines are sent to them. So those of us who get those requests need to really read what the guidelines are for that particular university or for that particular institution. It's a slow process to change promotion and tenure guidelines. I agree, it is slow. So we need to start immediately.
I wanted to do a follow-up question, and then I'm going to have her. The diversifying your funding portfolio, I did that very early on, and I was very unpopular because people were saying, why are you not writing NIH grants? And so I got a lot of kickback because the school was looking at the NIH grants as having the very large indirect cost. I was bringing in money to support my work that was mocked as too little money, but it did support the work. So could you speak to that with those other types of funding?
Well, obviously, we need to be more valuing of diverse ways of funding our scholarship. The gold standard of the R01 will probably always be the gold standard of the R01, and it's important. It has funded great science. It will continue to fund great science. A lot of nurses never receive an R01. They have research capacity, they have research interests, so they need to figure out other ways to get their work done, whether that be more efficient or effective, or to diversify their funding sources. I would say that the F&A issue is a real issue if you've been on any campus committees, because it does cost money for research to get conducted. So I understand the campus attachment to F&A rates, but I agree entirely we need to be willing to diversify. The point is, are we creating knowledge that's going to solve problems for patients and nurses? That's the point. Is there some way we can create knowledge that's important for nursing, regardless of how you fund it?
Okay, there's a question.
Diane, what do we University of South Florida? I don't want to come on back, I want to come on your question. And it's really just a food for thought question, but as we go about preparing the next generation of scientists, providing junior faculty, new graduates for support, I always wonder, what is everyone doing to maintain the momentum and provide support for mid-level, senior people? I mean, we keep asking more and more and more of them, but a lot of our focus is continuing to bring up junior people. So what ideas do people have beyond sabbatical, which takes people out for a while? I'm just trying to constantly hear what other people are doing that's successful and keep your own running.
I can tell you just one thing that we've done on our campus is we don't automatically assign a faculty member to every campus committee that requests one. There are many campus committees that want somebody from every school, and we now look at each committee and say, are we willing to relinquish having input on that committee? And a bunch of them, we don't care. Somebody else can deal with those things. We're not worried about the outcome. But it is a problem to how do you keep senior faculty moving with increased responsibilities. Other ideas about how to do that?
How many people provide unfunded time to senior faculty in their programs? Or is it once you make tenure, you just got to keep yourself funded?
Just a few. Looks like just a few hands went up.
Well, many schools provide some amount of research time regardless of funding, so the question might be whether or not they can have increased time for research. A few schools do that, it looks like.
Are there other questions or comments? Well, I want to thank you, Dr. Conn. This was such a delightful talk. And
Thank you.
Thank you.